Today we are going to talk about splinting for hand therapy. And first, to kind of start it off, we're just going to talk about why you need to learn how to splint faster. Now, every setting that you work in is different. Some settings in hand therapy, you don't even need to learn how to splint. But I would say if you are a hand therapist, the majority of those settings, you're going to have to learn how to splint. And it's going to be more beneficial if you learn how to splint the correct way and how to splint faster. And to me, the correct way of splinting is to learn how to splint without patterns. Now, what I mean by that, it's splinting without using patterns. So you need to have the pattern inside your head, but you need to learn how to splint without using a pattern, because when you're using a pattern, it just takes a whole lot longer to learn how to do the job. And if you read any books on splinting, they're all going to talk to you about patterns and how to learn those patterns. But after you get them nailed down and after you really understand how to splint without patterns, you don't need them at all, and it's so much faster when you're not using them. Now, splinting is time consuming. It takes a lot of time, it takes a lot of skill, and the more you practice and just the more you get better at it, the quicker it's gonna get. And a lot of times we have these patients, we may have like 6 patients that we're seeing in an hour, and a lot of times we don't have like 30, 45 minutes or an hour just to work on one patient for a splint. And so that's why it's so crucial to get really fast at learning how to splint quicker without using these patterns and just kind of having them in your head. And it's not all about that, it's about knowing the creases, it's knowing where to cut, and all of that comes with just more and more practice. And most jobs out there, they're not going to give you a lot of time to just learn how to splint. A lot of those jobs are just going to expect you to know how to do this before you even get started. So if you take a course or watch some of my tutorials that I have here, you can get a lot faster without needing that extra experience, and you can already say that you have that additional experience. And be sure to check out my book, Splinting Without Patterns, if you want to get better, if you want to get quicker at doing this, and if you want to know a simple way on how to splint and learn how to use the most commonly used splints for hand therapy. Now, the key to splinting without patterns, which I mentioned in my book, is all about visualization. It's memorizing that pattern, and when you can do that, you splint about 4 times faster than if you're using a pattern. If you're using a pattern, you are drawing the pattern, you are cutting the pattern out, then you are placing the thermoplastic or whatever material underneath, and you are tracing it out again, and then you're cutting it out. And a lot of times it's just extra cutting, it's extra time spent tracing and getting everything ready, when all you can do is just take a rectangular piece of thermoplastic or whatever material, place it on the patient, and just start cutting around their arm. And the next thing I want to talk about to learn how to splint faster is just to learn the creases. So there are a bunch of creases of the hand. You have the DIP, you have the PIP, you have the MP crease. If you see, if I bend my hand, you have that palmar crease where the MPs bend. So you want the person to be able to still move their hand and function as much as they possibly can within the confines of the splint. Now, it just depends on the splint. Some splints you don't really want the patient to move at all, but for the most part, for most splints, like a wrist cock-up or a thumb spike-up, you still want them to be able to move their hand to some degree so they can still use their hand for those daily activities. And the key to splinting without patterns, it's all about creases, right? So if you are splinting around those creases and allowing them to be able to still function, that's just gonna make their life so much easier. So for example, if you do a wrist cock-up and you splint like right up here, they're not gonna bend their hand. So you have to splint right under those creases so they can still like make a fist, so they can still grab things and use that hand. For the thumb part of the wrist cock-up, you want to make sure that that thenar is, you're still able to bend your thumb there. And so you want to make sure that you're cutting around that thumb as you come down. Some splints, you have just, if it's just like a hand splint, say it's like a Dupuytren splint where they have their hand just kind of straight and the wrist is not involved at all, well, they still need to be able to bend their wrists. You want to just make sure that splint ends before that crease at the wrist. So splinting without patterns, it's about like memorizing those patterns in your head, but it's also about the creases and just knowing like where your landmarks are. Creases just kind of show you exactly where you need to splint, and if you check out my book, it's going to kind of explain that to you in more detail. If you get splinting all in your head, if you get this down by just practicing over and over and then knowing the creases, you're gonna know how to splint better, and you're gonna know how to splint faster. And the last thing to know before you start splinting is just to have all the supplies ready. You don't wanna be fumbling around and not have everything there. You wanna make sure you have like the scissors ready, you have the splint pan like hot and ready to go. And everything should be like easy to access. Like if you're using cold spray or if you're using stockinette, like it should all be there. Your Velcro should be in an easy place to locate and to spool out. You should have a marking pencil handy. All of this should just be there and ready to go so you can do this quickly. Now another thing is placing the patient in the right position. Like the patient is just sitting there, they have no idea what you're doing or what they're supposed to do. So you want to give them precise, specific instructions. I want your hand here, I want your arm here. You have to position them, you have to tell them where you want them to hold it, and then you have to kind of reiterate like multiple times and cue them like, do not move, stay in that position. You may have to move them again and reposition them so they're not moving, because movement is going to be the biggest issue when you're splinting. If their hand moves, if their wrist moves slightly, if you're using thermoplastic, that thermoplastic is going to become a mold, and if they have that hand in the wrong position, you got to just make sure that you're constantly repositioning them and you have that correct and neutral position before you move forward. And another thing with splinting is a lot of times it's just simplifying. I see therapists and what they do is they spend too much time on the splint. They are cutting and they are just like trying to make it as perfect as possible, and that's where you end up making mistakes. You need to start off simple. If you're doing like a wrist cock up, you lay that thermoplastic on their hand, you let it kind of rest, you don't do anything to it. Sometimes I'll like pet it a little bit, kind of the thermoplastic, but you don't want to squeeze hard or anything like that because that will make the splint too tight. But a lot of times it's just, you're just letting the splint rest. While it's resting, I just start cutting. You start doing all your cuts as fast as you can because that splint is going to get really hard and you're not going to be able to make those cuts anymore. So the first thing you do is you just lay it on there and you just start cutting around their hand, and you can have a conversation to make the patient more comfortable because a lot of times they're stressed out when you have these sharp scissors going around their arms and their fingers. So just talk to them, try to make everything comfortable, make it seem like you know exactly what you're doing, and the more you practice this, the easier that's going to get. But the key here is just don't overcomplicate it. Once you start cutting more, once you remove that splint and you start cutting after the fact, that's where you have more errors. If you end up heating it up again, that's where it becomes more problematic. Sometimes you have to heat it up with like a heat gun or something like that to sometimes like smooth those edges over, but if you're using that heat gun to make any major changes, it's usually more problematic, and I'm usually against doing that. You just want to get everything nice and fast and quick and easy the first time around. You don't want to spend an excessive amount of time cutting and using the heat gun. You want to get it all done in one shot. I know in every case it's not going to work that. If you have a complicated splint, it's not going to work like that. But if you're doing the same splint over and over every time, like a wrist cock up or a thumb spica, everything should be quick and fast and done right on the first go when you first do those initial cuts as the splint is starting to cool off. Now, if you are new to splinting and you don't have a whole lot of experience, the key here is just to start practicing regularly. Just grab some cardboard materials, learn how to splint without using a pattern. Just use that pattern in your head and start like cutting cardboard on your friend or a relative. Just start working on it right at home. You just grab a rectangular sheet of cardboard, you just mark it up over the person and you start cutting it. I talk all about splinting with cardboard in my other videos, and I'll link those in this video if you're interested in that. But cardboard is the key. If you want to learn how to practice splinting fast, I would just use cardboard. Now the other option, if you want to get the real feel for it, is just get a small piece of thermoplastic. You can buy like these small rectangular pieces. They're pretty cheap on Amazon. You can heat them up at home and you can just start cutting them. I mean, that is ideal if you want to be like proficient and know how the material moves and how it molds around the patient. I think that is kind of the best way to go. But for like just getting started out, I would just use cardboard, use a ton of pieces of cardboard because you can easily just throw it away. Splinting material can just get really pricey pretty quickly, and so that's why I recommend just using cardboard just to get comfortable with it, just to kind of get the feel for it, and just so you can get those patterns in your head. And then once you get comfortable using cardboard, you just buy a small piece of thermoplastic, you start cutting it for those different splints, you reuse it over and over. And then you can just start working in an office or clinic and start splinting like that. And once you start practicing these skills over and over and over, it's just gonna make you a much faster splinter and a much better therapist. All right, guys, so I hope you enjoyed this video. Please like, subscribe. I will see you in the next one. Hope you have a great day. Thanks.